Lingard. We're going to do our ENT exam. Earlier today, we checked Lingard's distance vision using a Snellen chart, and his vision was 20/20. We checked his near vision by holding a newspaper about 14 inches away, and Link was able to read that. So his visual acuity was very good. We're going to examine your eyes, Lingard. And the first thing I notice is that the inner and outer campus is symmetrical. Your eyebrows are even and symmetrical and nice and full. I'm going to check your lacrimal duct. If I press right here, I see that you don't have any leakage or drainage from your lacrimal duct. Your sclera are white and your skin is intact. So now I'm going to shine this light across your eyes. And I notice that you don't have any abrasions on your cornea. I'm going to shine this light right in the middle of your nose. And the light falls evenly on both eyes. Your iris is round and your beautiful blue color is consistent. So I'm going to shine this light into your eye. I'm going to shine right here directly. And when I do that, I notice that your pupil constricts quickly, and that's your direct reaction that we tested. And now if I do this and I watch that eye, and it constricts briskly. So we did your direct and consensual reactive, and they were both good. So Lingard, can you please look across the room? And when you do that, I notice that your pupils dilate. And then what I want you to do is look right at my finger. Very good. And then I notice that your pupils constrict. So your visual acuity is very good. Okay, so now I would check your corneal reflex, but that requires to take a small cotton tip and touch your corneal, and what I would expect to see is that both your eyes blink. So we're going to pass that one up because that one's just, you may not like that one very much. All right, so now what we're going to check Lingard's eye. I want you to follow my finger and don't move your head, just your eyes, okay? You're going to make the form of a letter H here. Sort of an H, right?
Not even close.
Don't move your head. Okay, great. So what I notice is that you have very good parallel tracking. I didn't see any nystagmus, and your extraocular movements are all intact. So now we're going to check your peripheral vision. So if you could please cover that eye. I'm going to cover this one. And then tell me when you see my fingers wiggle, okay? Are you ready?
Yep. 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 Yep.
Okay, great. Now we're going to check your ears. I see that they're symmetrical, and if I draw an imaginary line from the outer campus, right here, the tip of your auricle falls right within that line, and that's what we expect. Earlier today, we measured Lingard's ear, and it was just about 3 centimeters, which is normal. 2 to 4 is normal, so that was good. Okay, Lingard, now the other thing that we did earlier today at my office when we had equipment was that we checked Lingard's, we used a tuning fork, and I activated the tuning fork, and we held it here at the top of Lingard's head, and he could hear for just about 20 seconds, and then we activated it again, and we held it here, and Lingard could hear for about 15 seconds. So we could see that his bone and ear conduction was intact. Now Lingard, when I pull on your ear, can you tell me if you have any tenderness?
I do not.
Okay. When I check back here, do you have any tenderness?
Nope.
Okay, great. And we also took a light and we looked into Lingard's ear canal. It was pink and intact. We could see his tympanic membrane and no drainage or issues with that, right? Okay, so now, Lingard, I'm going to check your hearing. I'm going to stand about 2 feet away, and I'm going to whisper, and I want you to tell me what you hear, okay? So close your eyes. Okay, tell me, did you hear anything?
Yes.
What did you hear?
Wolfie and Maya.
Very good. So your hearing is good, and now we're going to examine your nose. So I know that your nose, I can see that it's midline. When I press here, you don't have any tenderness, right?
Nope.
You don't have any up here.
Nope.
Okay, so now I'm going to take a light. I see that you don't have any nasal flaring. And when I look up in here into your nares, I see that they're pink and moist and intact. So Lingard, can you compress one side and breathe in for me? And then compress this side and breathe in for me? No problems doing that, right?
Absolutely none.
Okay. So now, Lingard, we're going to check your mouth. I see that your lips are pink and symmetrical. Can you open your mouth and stick your tongue out for me? And your tongue is symmetrical. I can see your uvula. The inside of your palate is pink. I can see that your hard palate has transverse rugulae. And your soft palate is pink. I don't see... Can you take your tongue and lift it to the roof of your mouth for me? I don't see any lesions or ulcers, and you can move that freely inside. Your teeth are in good repair. And I see when you smile, your smile is symmetrical, your teeth look great, you have that inherent little gap between your front teeth, and I don't see, your gums are intact, I don't see any bleeding. So overall, Lingard, I say that you're a fine, handsome young man and you're in great shape. Thank you.